Good morning. Welcome to Viewpoint, your program of personalities, politicians, and perspectives. This morning we'll work on the perspective business and the personalities. We'll just leave the politicians go to the... Never mind. This is a household show. We won't do that. In any event, we always, both of you listeners out there will remember we always try to start Viewpoint with a kudo or two. One of the things I really enjoy doing, and Mrs. Busby too, let's say this is a we thing, not mine. We love to read about our youngsters in school who made Student of the Month and so forth, made their academic achievements and so forth. So we got to let's just talk to Lighted Arrow in the airport. We have Drew Martin, Mount Pulaski, Abby Steinvetter. I hope I said, I sure hope I did that right. Anyway, these two young people are Students of the Month, and particularly, of course, if the name Martin, of course, brings you to Vinegar Hill, and I have some dear friends over there. They have lots of friends named Martin over there, so we're happy to recognize these two youngsters, and also, and this is important, particularly with all this business about the men in blue and so forth. Lincoln Police Department, they received an Excellence in Policy and Training Award from a very prestigious firm.
In policy, and what was the second word?
Policy and Training. Well, so Chief Paul Adams and his group, and we have Chief scheduled on here soon. Next week. So we'll be able to talk about that. So, congratulations, Paul Adams and staff. And at this point in time, now we'll just turn with the lady who runs the show, owns 51% of it anyway. Mrs. Busby, you go right ahead and take charge, please, dear.
Not so much. Well, we're very happy to have with us today Dr. Zwilling.
Yes, we are.
And also Mary Anderson. Mary, of course, is Logan County Department of Public Health, and she is in charge of communicable diseases. So that keeps you off the streets, doesn't it?
Yes, she. By the way, she's in charge of the sharpest
needles. We got a good one going.
Yeah.
I tell you,
Pardon me, Mary, while we let the cat out.
See, we're partly ASPCA here.
Out of the bag. Mary is also in charge of the sharpest needles in operation. When you get your flu shots there and any other little things you have to do. I'm just going to make a quick comment, and then I'm going to shut up for you, Mrs. Busby. When you go to the Logan County Health Department, you know doggone well you're going to be well cared for there.
And courteously and friendly-ish.
Yeah, absolutely.
That's very good to hear. We appreciate that.
Well, you do. You run a good show. I've said that publicly many times, and it's not anything I say lightly, so thank you very much. Go right ahead, Mrs. Busby. I'm going to sit on my lap.
You're going to what? He hasn't had enough coffee yet. Anyway, Mary, God love you. You're keeping all the balls in the air. And right now, you had a bad day. You have new cases again.
Right. Cases are on the rise, unfortunately. I checked the screen this morning before I came in and saw 10 new cases.
Oofta. That 10 is a lot.
It's a lot.
And Dr. Zwilling, hats off to you. Here you finally got to retire from your day job and you're right back in it. Bless your heart, you and Dr. Kesa, for stepping up to the plate and helping Mary poke all of our arms.
It's our honor to be able to do this to help.
We're very appreciative. Do you both cringe when you hear another city that's deciding that, well, what the hey, let's just throw caution to the wind, we'll open everything?
Well, when you hear that, all we can think of is there's going to be more cases, more spread, more contacts, more closures, more quarantines. Yes, it's not a good thing.
What do you do with a public like us? I just want to say first, to cover us, we three have had our shots, so we weren't being lax. But a lot of people haven't bothered, and a lot of young people went to Florida. Did you notice?
Oh, boy.
Yes.
What are you looking for down there?
Yes. Well, that's going to be a hot spot.
Sure.
People from all over the country over spring break go to Florida, and then they come back, bring it home. So we expect more cases from local people that went down there.
Sure.
Pretty mind-boggling how these kids would congregate down there in spite of all their warnings, and the Lord knows they had a plenty. And then if somebody gets sick or carries the germ back to some older person back in Indiana or God knows where,
He's talking
and
about us
then
now.
exponentially just keeps going out. Oh,
Right, it does. Right.
we've had to give up a lot of things here in Lincoln, Logan County, downtown on the square activities. It's a price you have to pay.
It is. It is. Closures, and unfortunately, some sports teams have had to been quarantined
Oh, yes.
because of exposures. A team player from another team was positive, so when that happens, you quarantine both teams because you don't know who touched the ball.
You know, every once in a while you run across another article that talks about people and what they're facing emotionally because of this business. We have friends who have really quarantined themselves because they were so frightened of this. What's your take on that? There's got to be a happy medium somewhere. I wouldn't go down to Florida, but then on the other hand, I didn't stay in my closet either.
You can do what Dr. Zwilling and Dr. Casey do. They go to the park.
And run, don't you?
Well, we walk out there, actually. But that's one of the things that we started to try to help get yourself out of the house and to be able to, be giving yourself some exercise as well.
Yes.
Same time. And a good time, to be able to talk with other persons. You don't have to wear a mask outside like that, at least
No.
we don't.
Now, as an MD, do you advocate kind of a semi-quasi quarantine?
In what respect are you talking about?
Well, it should be.
Have you been
people
infected or even
shouldn't go
without
to Florida,
infection? Pardon
right?
me?
People shouldn't go to Florida, okay? But what's the happy medium? Where do you strike it?
Well, really, it's honestly, if everyone was able to follow the recommended guidelines, I don't think there would be nearly the issue now that there has been. And what are the recommended guidelines? Masking, distancing, hand washing.
Common sense.
Sure. And then following, again, the other recommendations, whether or not the CDC recommends travel or not, use of airlines, public transportation, those sorts of things.
Well, I think God imbued most of us, not all, most of us with some common sense. And you don't have to listen to Dr. Fauci or anybody else. Just use your head and know, instead of spending the morning at Old Joe's, which is a nice place, by the way, you're better off in the park. And the residual of that is, COVID notwithstanding, physically, you're better off in the park anyway.
That's correct.
Does that wow you?
You just dazzle me with brilliance day in and day out.
Well, look at us. We've had our vaccines. We are enjoying each other's company without a mask on. It's that easy.
Maintaining distance, now
That's
they've
right.
changed that from 6 to 3 feet.
Yes, schools, though, are still encouraged to go 6 feet with
They
the
are.
desks. They still are encouraged to do that, if at all possible. Some
Well-
schools are bigger, and they can't get as many students, at 6 feet, so then they compromise to 3 feet. But if someone's a positive case, they still go back the 6 feet to determine who those contacts are in that airspace.
Judith, we're sitting here with a couple of professionals, and I don't, it's once in a while I come up with a trite remark and so forth, but I'm very concerned about our youngsters in our schools. Some of them are just going to inevitably fall through the cracks. They're going to become victims without being ill. And I think that's going to come true just as sure as I sit here.
Now, is that in regard to online learning, or is that in regard just to
Yes,
the lack of socialization?
Online learning and being out of the regular swim of the flow of education. And some kids are not motivated anyway, and those kids that are less motivated, they're going to fall off. That's just
And some don't have anybody at home who's computer savvy And so who's going to help them? This is, he and I have discussed this ad nauseum because we've got grandkids who are in school, little people, and it's a concern. They should be there.
I agree. My little people, I have, the triplets, the 3 grandchildren, and then an older one. The triplets go to preschool, and then Reagan is in kindergarten. What they have done when they had to stay home, each one had their separate laptop, and they were communicating with their teacher through their laptop.
Yes.
So you can imagine they're each in a separate room, and they see each other on the screen, and hi.
Oh, sure. Well, especially with 3. I didn't, if I knew, I'd forgotten. That's quite a challenge for your family.
Well, for all families that have many children in the school system.
Yes.
Yes,
Yeah.
it is.
Now, this morning in the news, they said that 14% of us in Illinois had been vaccinated. Is it that we don't have enough vaccine, or is it that we're lax?
The vaccine has become available. In fact, there have been openings for people to go and get the vaccine. Some, though, prefer a certain brand of vaccine, so they're waiting on this brand or that brand to come through.
That's a thought I never had.
Because of the number of shots, okay?
Yeah,
Johnson & Johnson, it's just
Just
one
a
shot.
winner, yeah.
Yeah, they're all equally as good, but some people have a needle phobia and rather have one shot instead of 2 shots.
Yeah. So where are your clinics being held now?
Faye Allison is in charge of that. She has clinics at the rec center. Dr. Zwilling's helped with that. The health department has clinic openings. The hospital, they're doing clinics.
That's where I happened to go. And by golly, they had a well-oiled machine there. They should be proud. It really went along swimmingly. Now, this new news that we get today about 10 new occurrences, what's your take on that, Doctor?
Well, basically, are these cases from gatherings otherwise?
I haven't explored them
Or you
yet.
don't
We
know
have a
yet?
screen, and they pop up on the screen, so it's for us to call.
Yeah, I mean, we've had a good response to getting vaccinated, but again, I haven't seen the numbers of the age groups, that's been vaccinated, but it's been mainly the older and elderly that we've done, plus, of course, the healthcare workers and the frontline workers. My suspicion is it's probably coming when it's a number of cases like that there's a good or better chance that it's probably related to social gatherings that have unfortunately had a positive spreader.
Surely the social gathering element must be a chronic problem with any communicable disease.
It is.
But with this, it's so much worse.
It is because it's a rapid spreader. COVID spreads rapidly. We know that. People
They're really
without masks.
healthy germs, aren't they?
Ugly
Speaking
germs.
of spreading, we have messages that we'd like to spread out here on behalf of our sponsors. And without the sponsors, we're not going to sit here and talk to Dr. Zwilling or Mrs. Anderson. So go right ahead, James. Right back live in the studios here, WLCN 96.3, high on a windy hill. Our guest this morning at Viewpoint, Miss Mary Anderson, representing the Logan County Health Department. Gosh, she does a great job out there. And Dr. Thomas Zwilling, who's retired now, and he has got more time to exercise and take care of himself that he didn't have the time when he was busy actively practicing medicine and taking care of some of you dummies that don't know how enough to take care of yourself. So, Dr. Zwilling, we're glad. He and Dr. Paul Case have retired. But they didn't retire. They just retired from active medical practice. They're still serving the Logan County community in their profession. And so I doff my hat to you, sir.
Thank you.
And Judy, if she had a hat on, she'd doff it too.
And I bet Mary Anderson could kiss you both right on the cheek, couldn't she?
They're very helpful, that's for sure.
Oh,
yes.
Oh, my, yeah.
She gives us cookies instead.
Oh, does she? Well, I think that's nice payment. It's
We
not
agree.
quite what you're used to making, but
Mary's
Not
job
best
at
for
the,
health, but oh well.
Mrs. Anderson's job at the Logan County Health Department is she's in charge of sharpening the needles. And boy, she does a whale of a job.
Now, I'll add something to this. Okay, since COVID started, I haven't had to sharpen any needles.
No,
I'm totally out of that area.
it's out of your
I
department.
am.
Oh.
Yes.
You got
Yes.
promoted?
Well, I don't know. It's a lateral move, I think. But anyway, I'm not doing any of that.
Mrs. Anderson alluded to the fact that they've uncovered or discovered, whichever the case may be, some new cases of COVID here, just overnight almost. What does that portend? Do you have any idea at all? Could you begin to fathom a guess?
Well, I saw the age groups. There were some in their 60s. There were some that were high school age.
Really?
So I alerted the school nurse about that already. So she's trying to now decide who individual was around in that airspace, that bubble as we call it. So as we're speaking now, she's determining which children to quarantine. So I worked with another school last night determining who to quarantine in their bubble.
As if your caseload wasn't heavy enough. Prior to COVID, our health department had a heavy caseload on a daily basis. And of course, all that done is just add on to it significantly.
We've had to cut some services, blood pressure checks. People are used to coming in for blood pressure checks, but now with COVID, temporarily, we've eliminated that. But we have started clinic, and the clinic nurses are doing the shots again for the children, and B12 shots and various things. They've started that up again, but we've had to cut down a bit.
Do the merchants and business people here in Lincoln and Logan County talk with you at all before they started to open up, so that you had any input into maybe it's not time to be wide open yet, or whatever your advice would be?
Not personally with me, perhaps with Faye or Don, who might handle more of the business restaurant aspect. But everyone has their guidelines. They know what they're supposed to follow, the rules, and so we just depend on them to do that.
Well, Gene and I don't get out very much. We've kind of hunkered in. But, for instance, some of our restaurants, boy, they've had a hard hit. And, I really get concerned. And some folks aren't going to make it through this doggone thing. And we have the wait staff. By the way, those folks who are out there, be a little extra generous with the wait staff. Been kind of tough for them, so lighten up a little bit and drop an extra couple of bucks or maybe even a $5 on their plate for them. But there's so much in the community that is directly affected, plus the indirect effect. For instance, small business owner in a restaurant, how the heck do they know how much produce to buy?
Yeah.
Good question.
A little thing like that,
Right.
very insignificant, but it's not insignificant to the guy who has to make that decision.
Right.
So let's be a little understanding. What do your professional opinions between the two of you? When you walk in, you must wear a mask walking in, say, for instance, Daphne's. Then you can take the mask off to eat and so forth. Why do you walk in with a mask?
You might be
Oh,
traveling at the same path as someone else, or crossing a path with someone that, if they would not have a mask on, might have the germs. So that's why it's wise for people to, as they're going to their seating area, to wear the masks.
Well,
And keep it on, really, until the waitress comes.
that was the best advice that could be given for a long time, until they came up with the vaccine. They thought that would be your safest bet, the
well, the
mask.
vaccine's not going to prevent the transmission of my germ to you. The vaccine's not going to help that.
Oh, no.
The vaccine's going to help you get from being out and around in the crowd where it's being carried.
Well, a lot depends on the mask, too, really. How do people wear the mask? They're supposed to wear it fitting tightly across the nose, having it fit tightly around the ears, so, there's no air coming out. Fogging
to
your
wear it
glasses.
below your nose isn't helpful, is it?
That's not helpful. No, that's not helpful.
gonna work.
Because that's
No.
where the virus resides, is in your nose.
That's right.
That's where it harbors itself?
That's correct.
Is that right? What's with this mutating of the virus? Does every virus have that right and job?
Yeah, well, it's a very common occurrence for viruses in general. I mean, like the influenza virus does the same sort of thing. That's why they have to change, to some degree, the flu vaccine every year. And so it's just one of, I guess you'd say, nature's laws that things will sometimes change slightly just because of length of time and tremendous numbers. You know, there's millions and probably billions of viruses, and even just the coronavirus, there's so many copies of that. There's a significant chance that there's going to be one that didn't come out quite right. Just as if, you know, when babies are born, sometimes they have some defect. It's the same idea with viruses too.
It just happens.
It happens. That's the way God made things.
Dr. Zwilling, you were in practice a long time. Came the time you decided to hang it on the hook. What was your personal feeling the next day when you didn't have to report to Family Medical Center? Gosh, what am I going to do today?
No, it just kind of felt strange, although,
Yeah.
you know, you would still get occasional time off, but once those days kept happening, then that's when it really seemed a little different.
Yeah.
And days do that. They keep happening, don't
That's
they?
correct. But I've found ways to take care of each day, so
And if he didn't, Margaret did.
that's right.
I know something about that. So I know whereof I speak.
Yes.
Mary, what is the one? I don't want to make this heavy. What I was about to ask is, what is the one problem you face that's most important? And that's kind of a heavy question. That I don't mean it in a heavy way at all. But every day things are different out there. Now, for instance, today you've uncovered this advance of COVID. But what is the one significant problem that you have when you walk to work?
I wonder how the people of the previous days are feeling. You take some of this home with you.
Oh, I bet.
I've spoken to people on the phone, and, oh, I'm fine, you know, it's like a cold, it's like a sinus infection. And then we might check on them, as Dr. Case and Dr. Zwilling do. Oh, they've been admitted to the hospital now. And then we find out they'll be transferred to a larger facility, you know, to Memorial, to Barnes. We hear then they're on a respirator, and then, unfortunately, some succumb. I mean, it's a heavy load thinking about this every day for, well, really everybody. What's going to happen the next day? Some cases are light, others aren't light. So you can't take it lightly.
Well, that's because you're a conscientious worker.
Well, I think anyone in the
Well,
healthcare profession would feel this way.
Well, that's very kind of you. I suspect you're close to being right, if not right. Human nature being what it is. How big a staff do you have out there?
Oh, probably, I should have probably counted them, maybe 15 to 20 total, you know, doing various jobs.
Yeah.
Yes.
Well, the thing if you walk in out there to go your health department there on 3rd Street, the one thing you're going to be sure of, you're going to be greeted professionally and politely, and your business at hand is going to be taken care of in a forthright manner. And they just do it because of training.
We've had people take extra roles now, too. The secretarial staff, they can be contact tracers now, and they're assisting with that. Cindy Harrelson's in charge of the contact tracing, and she has a number of individuals working with her. Kara, the nursing director, she is now giving the shots and doing the tests. Carrie, the clinic nurse, she focuses on a lot of the shots now for the vaccine. So we're all kind of doing different jobs at this time.
Branching out,
We
aren't
are,
you?
yes.
But you're significantly aided and abetted, as the saying goes, by having Dr. Zwilling and Dr. Case to be there available to be of assistance to you.
Oh, yes.
And that, of course, is for the good of the whole community.
That's another story. I'm glad they're helping me.
Yeah.
Oh, my,
yeah.
yes.
Does he ask for more money?
What about this reaction that people are claiming to have from the second shot, and it doesn't seem to be any one company's
Right.
vaccine that's bothering people. Or are we yelling before we're hit? Sometimes we do that too.
Well, and some people we found do tend to have more of a reaction with the second one. I think, as Dr. Zwilling can add to this, that it just really took well. It's kicked in, it's doing its job.
Yeah.
Yeah, and these are just considered, I would say, minor side effects. I mean, people don't feel good with some of them, but they're very short-lived. They're generally no more than 24 hours, if even that sometimes. And again, they're expected things.
And they beat the socks off of having the virus.
Well, Judith K., once again, we're almost done with the program, and we didn't give the opportunity for both of our listeners to call in. 648-5510. Somebody surely has a question of Dr. Thomas Zwilling or Ms. Mary Anderson, representing our Logan County Health Department. They're the nuts and bolts of what goes on out there, folks, and if you feel bad, go out there and they'll give you some advice. So 648-5510. If you have any question, be nice to them now. Be nice to them. Don't tell Dr. Zwilling about a bad hook.
Initially, they thought the children had some kind of an automatic immunity, but that seems to have been dispelled now.
Initially, we were finding less cases in children, but now we are finding cases in children, whether it's the parents that bring it home to the children then infect the other children. But yes, we see children as well, but I do feel that there's less cases in children.
I wonder if there is maybe a significant core that's not with symptoms, asymptomatic.
That's right.
Maybe that's why we don't always notice kids having it as much.
And they can be spreaders.
Yes. There's people out there who say, I have no idea where I got this from. But they could be from, like I say, asymptomatic people otherwise.
Well, sometimes someone will ask you, have you been exposed? I don't know. I have to go to the grocery store.
How the heck would you know?
Yeah. I could well have been, any of us. We could be exposing one another and not know it.
When I interview people, that's one of the questions I ask. Where do you think you picked up the virus?
Yeah.
Some have a definite answer. They know, yes, because, family members or friends and they had dinner or whatever. But then others, same thing. Well, I don't know. I just go shopping. I just go, to here and there. But no, I don't know how I got it.
What in the world do you as professionals say to somebody who won't wear a mask? By George, Dr. Fauci's crazy. Or to somebody who won't have the vaccine, because that's just a bunch of hooey.
Well, I say I do it to protect others. I took the vaccine, I wear a mask, not just to protect me, but to protect other people around me, because could I have been, before the vaccine, an asymptomatic carrier? I don't want to take a chance infecting others.
Yeah, I wouldn't be able to function as well as I could if I thought I had caused someone to get seriously ill or even die because of something I did, which could have been easily prevented.
Good point.
So anyway, that's the reason why I do it. That's why I wore a mask here today.
But see, you're that kind of people, and we're living in an age where many, many people don't think ever about how what I do is going to affect somebody else. It's just all about number one.
That's true. It's true.
Well, I carry my mask in my car all the time, and when I open the door, I grab for my mask. And 2 or 3 times I've been halfway to my destination and, I forgot my mask. So I went back and got it because of consideration for others. And there's a big problem. A lot of people don't have any consideration for others at all. And you can't help those people.
And are we getting lax? Initially, we were wiping our cans down from the grocery store. We were worried about this. We were spraying our cans. We were wearing gloves at the pump, at the gas station. I mean, are we doing all these things now, or disinfecting our hands afterwards?
Now we're getting a little bit lax.
What is the youngest child that you're aware of that had COVID?
Less than a year.
Less than a year?
Less than a year.
That's amazing. My goodness gracious. Now you just ask yourself, how in the world did a child that young get exposed? Who knows? Where the parent had that child.
Last night
Could have been Alvy's drugstore on the corner of Chicago and Broadway.
I remember that.
Last night on the news, they were talking about a lung transplant from somebody who'd obviously died, because otherwise they don't take your lungs. So,
I didn't know that.
You learn something every day, Bill. Anyway, this person had COVID and survived, or didn't survive, but he beat the disease and died of something else. And so they took his lungs for somebody else. Now that's amazing.
Well, and they question about, are you sure you want to be doing that sort of thing, putting somebody's lungs who actually had COVID? But obviously these people have studied how these things work and what's the best thing. And obviously, too, this person probably had no other choice. They probably were going to die if they didn't get that.
Yeah, right.
At least that's from what I would know, little I know about it, that's what I would assume.
I have a grandson who was in the hospital for 2 weeks because he had COVID, and it affected his lungs very, very badly. But the people who are so deeply affected by it, are they most oftentimes people who've had some kind of issues in the past with their lungs?
Well, it's somewhat variable, but in general, I'd say the majority seem to have some underlying medical condition that makes them more susceptible to it. It's not always that way, though, and that's why we just don't always know all the information, only what we're given, but there are not a lot of very young people who have succumbed to this disease as well, too. And again, they don't always tell us what their underlying medical problems were. But we know that a lot of the people have significant problems with their lungs, such as asthma or COPD, and certainly persons with cancer are going to be much more susceptible as well too. And they found hypertension or high blood pressure and being overweight or obese is also some of the risk factors.
Diabetes?
Oh yes.
Smokers, vapors, they're at higher risk too.
People think vaping is more safe than cigarettes. What's your take on that, since you brought it up?
There's problems with vaping too.
Pardon?
There's problems with vaping as well as cigarette smoking. Yes.
Oh, I would guess. Oh my, yes, I would guess so. You're messing around with your breathing apparatus. It's as simple as that. You don't need to be a scientist to understand common sense. But again, I repeat myself, there's not much of that out there. I'm sitting here thinking, Judith, Dr. Zwilling, Dr. Case, and others in their category that are retired from medicine, they're a lot different than my uncle, who practiced medicine doctor in the hard, cold country of Pennsylvania. And he got paid in chickens and hogs and whatever else they could scrape up, or didn't get paid at all. So on the day of his retirement, he drove out of there. He's headed for Philadelphia, and he got to the top of this hill around Scranton somewhere, and he got out of the car. True story, Judith. And he opened the car door and thumbed his nose at the community down below. Had said something acerbic to my aunt and got in the car and drove off.
That was unfriendly.
I cleaned that up a lot.
Yeah, I bet.
But we don't have doctors like that anymore. Unfortunately, or fortunately for him, his aunts left him a lot of money. He could do that. He quit a lot younger than you did, Doctor, and didn't worry about his pension. He had it. But in any event, I don't want to make light of this. The folks like Dr. Kesa and Dr. Zwilling and other doctors in that category who have retired continue to help their communities. And so, sir, we salute you, sir.
Thank you.
Yes, when Dr. Case retired, well, the COVID, was after that, of course. He called and he said, what can I do to help? He says, I know somebody else that wants to help too. So there they are.
There you go.
Well, God love them, really.
This is your last shot, folks, 648-5510, and then we're going to thank the doctor and Mrs. Anderson for being with us, and we're all going to stop at Old Joe's on the way back home and celebrate the morning.
What happened to the Lawndale Tap?
Well, we stopped the Lawndale Tap going to Old Joe's.
If you had a crystal ball, what do you think it would say about what is in store for us with this COVID?
Well, the way it's looking now, it's getting worse instead of getting better. We just,
It is.
Well, the case, as of last week, the cases have started going up locally. I think down the road, if people vaccinate, and Dr. Zwilling may chime in here, if they vaccinate and they, follow the precautions we're supposed to be following now, it's going to get better. But when's that going to be?
Yeah, it's really too hard to tell. When this first occurred, about a year ago, I thought this was going to be pretty short-lived, like probably most of us did, maybe a couple months or something.
Yeah.
Yeah,
I was
right.
way off. And even now, then, I think it's going to depend on our level of immunization as far as what percentage, and I just don't know where that's going to be at.
Well, that 14% that I
Yeah.
just heard, that's pretty puny.
Yes, and I'd say almost 3 months into vaccinations so far.
Yes.
Of course, we got a long ways to go. Obviously, they haven't had enough vaccines for nearly everyone yet, but at some point... we're
Mary
going to.
Anderson, Director of the Logan County Health Department on 3rd Street. Thank you very much for being with us. Dr. Tom Zwilling, Director of Retired Doctors of America Incorporated. We appreciate your being with us, Tom. You've given of your time like you do every day, and we thank you very, very much. Mary and Tom, thank you.
Thank you, and thanks to all the healthcare workers out there.
Bless their hearts, yes.